Well, whether you are fighting a cold or just got out of the ER, you've likely relied on some form of prescribed medication at some point to get you through a rough patch. But access to those meds isn't always easy for some.
Well, now the Amistad Community Health Center is looking to create their own internal pharmacy in Robstown to help be a buffer for medication that often costs a lot and is sometimes unavailable. Josh Maxwell is here tonight with that report. And Josh, I can only imagine just how important a pharmacy like this is going to be for the community.
Mike, yeah, it all boils down to the 340B drug pricing program. It's a system that helps hospitals and clinics with growing medication costs, but if they go through third-party vendors like Walgreens or CVS, that list of available drugs can be limited, something this internal pharmacy can fix with those prescriptions already being in-house. We all have that one drawer or a cabinet that we run to during the hard times. Whether it's the flu or you just need instant relief, you've probably grabbed a few of these.
We're going to be able to do a lot with medications.
Amistad Community Health Center CEO Dr. Baggerman talking about the initiative for an internal pharmacy at their Robstown location. He says due to the changing nature of the 340B drug program, certain and often vital medications aren't available to patients, something the new pharmacy hopes to fix.
An internal pharmacy within an FKC is going to give us a number of those medications back that were being used before that were taken off.
This is my expensive medication.
Maria Hunt showing me her blood thinners, a medication her doctor prescribed after she was rushed to the hospital last year for a blood clot in her leg. Because of her insurance, Hunt doesn't pay a penny. However, without it,
I would have come out with $3,000 every month.
A reality Hunt says is common for many others.
Because without your medication, how are you going to survive?
Hunt says with rising inflation costs and unexpected medical scares, it's enough to make even the strongest person buckle.
The way everything is so expensive, you're going to have to decide either my medication or my food.
A hardship she says she's heard about from family and friends.
Sometimes they tell me too, that they just get tired of taking some, much medication. Some are able to pay and some don't.
Baggerman says that if everything goes according to plan, they should have the pharmacy up and running by late summer of this year. Back to you.
All right, Josh, thank you for that report.